everyone, hope you've been staying safe and healthy, and welcome back to my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week, I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and your hometown with your question. I'll pick a few questions each week to discuss in the vlog. This week has been a roller coaster ride. Cases are still out of control, and it's pretty much all Omicron now. Omicron causes less severe disease though, so we are in this strange place where your individual risk from COVID-19 is lower than ever, especially if you're vaccinated, and even more so if you're boosted, while the risk to society from workforce disruption and overwhelmed hospitals is still enormous. Bottom line is, you do not need to be panicked with worry for yourself or your family, but you do need to stay vigilant. There's some good news. Cases are coming down in some of the places that saw Omicron first: New York City, DC, Puerto Rico. And the viral levels in the Boston wastewater are really plummeting now. So I expect cases to start coming down soon and hospitalizations and deaths to follow. This week, hospitals started reporting a new metric designed to help estimate what proportion of COVID hospitalizations in Massachusetts are due to COVID versus incidental. We're using whether a patient is receiving the drug dexamethasone as a proxy for that. And here at Tufts Medical Center, less than half of our patients on a given day have received dexamethasone. I find that reassuring that severe disease is so much less common than it was with previous waves. Our first question comes from Heather from Bellingham. I was told by the Board of Health that if you are not boosted, you're not considered vaccinated for the Omicron variant. Is this true? And if so, are children ages 5 to 12 who just recently received their first and second vaccines for COVID also not considered vaccinated for this variant? Or is it more related to the timing of when you are receiving your first vaccines or your booster? Heather, the new guidelines are so confusing. I don't blame you for not understanding them. The CDC has not technically changed the definition of fully vaccinated. But for the purpose of quarantine after exposure, they now differentiate between those who are and are not boosted. So I'm putting the new Massachusetts rules up on the screen, and they're taken directly from CDC. If you're exposed and you're either boosted or have had 2 doses of Pfizer or Moderna in the last 5 months, or a dose of J&J in the last 2 months, you don't need to quarantine. If you don't meet those criteria, you are supposed to quarantine, unless you can't. And they don't say what can't means. Just to make it even more confusing, the rules for schools are different. Kids and school staff with 2 doses of mRNA or 1 dose of J&J are allowed to go to school, regardless of the timing of those vaccinations. In any case, they recommend but do not require a test on day 5. That can be a PCR or an antigen test. Of course, if you develop symptoms, isolate immediately and seek a test. Our next question comes from Gail from Dedham. Is there any data to suggest that double masking with 2 surgical masks provides any extra protection against the Omicron variant? Hi, Gail. No, I don't recommend wearing 2 surgical masks. You see, surgical masks have very, very good filtration, and they're what we wear in the hospital to take care of patients as long as they're not known or suspected to have COVID. Surgical masks are less effective than N95s, but that's because of their looser fit. So doubling up won't help that. You can make a surgical mask fit better by putting a cloth mask over it to close the gaps, by wearing a mask fitter, which is a stretchy device that fits over the mask, or by using the knot and tuck method. If it's important to you to avoid COVID infection and you can tolerate it, KN95, N95, KN94 masks, and any mask that's called a respirator combines both fit and filtration. Now, they can be hard to wear for long periods of time, and if that means that you need frequent mask breaks when you're out in public, well, that can actually increase your risk. So experiment with different options at home first. Our last question comes from Fachona from Dorchester. I'm unvaccinated and tested positive for COVID-19 4 weeks ago. Now that I have recovered, I really would like to get the vaccine. When am I eligible to get it? Will my allergy to eggs cause any problems? I am glad that you're okay after your COVID-19 infection, and I'm glad that you want to get the vaccine. You can get it right now. Your egg allergy isn't a problem at all since the COVID-19 vaccines do not use eggs in the manufacturing process. And because your infection was 4 weeks ago, it's quite possible it was a Delta infection, not Omicron. And a prior Delta infection is not nearly as protective against Omicron as prior infection was against other variants in the past. I'm seeing people get reinfected in a relatively short period of time because of that. So I recommend you go ahead and get vaccinated ASAP. Our vaccine clinic here at Tufts Medical Center is walk-in, 8 to 5, 5 days a week. That's all the time we have for this week. You can send me your questions about the Omicron surge, booster shots, COVID testing, or anything else related to the pandemic or infectious diseases to a doseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.